Excellent. Well, it's another great day in Queensland, of course. We've managed to keep COVID out again, another 0 day here, but we're very much focused on our race to get vaccinated by the 17th of December. And I can advise that we are now statewide, 74.05% of Queenslanders have had their first dose and 60.41% have had their second dose. But as we've been saying, we're concerned about the regional variation, and here in Mackay, roughly 67% of people have had their first dose, so quite a bit below the statewide average, and less than 50% have had their second dose, and that can get even lower in other nearby regions, so as low as 45% with a first dose in Isaac and 64% with a first dose in Whitsunday. And so today we took the opportunity with all of the state's mayors here in town for the Local Government Association of Queensland conference to talk together about how we can get all of our communities' vaccination rates up. What will it take in every part of Queensland to get to that goal of 80%? And who better to give us that advice than local leaders, people who know their communities and know what will convince them, what will make it convenient, where to put the pop-up clinics, what ambassadors we need to send into communities to talk to people about getting vaccinated. So that's the conversation we've had today, and then here we are all standing together before you with a united message to Queenslanders that now is the time to go and get vaccinated. Go and get your vaccination. If you've had your first shot, go get your second one. If you haven't started yet, now is the perfect time. If you go and get your first vaccination this week, you can be protected in time for the 17th of December when the borders open and we expect the virus to begin to arrive here. So from here we'll hear from the Deputy Chief Health Officer, who's also in town, and then a number of spokespeople from the LGAQ and our councils.
Thanks, sir. Thank you. And just to echo the Deputy Premier's words, 0 cases today, but the most important thing is that just buys us time, and it gives us time for everybody to get vaccinated. The message really is, if you've got symptoms, go and get tested. If you haven't been vaccinated, go and get vaccinated now, because 17th of December is coming and COVID will inevitably come with that as well. So just ask everyone to protect their families, protect themselves and protect their communities. Get vaccinated while you can. Thank you.
DP, good morning and thanks very much for being here. We've got all of the mayors of Queensland and a lot of councillors in Queensland here in Mackay for the local government conference, which is tremendous to see. The show of support of Queensland's vaccination rate just upping the ante is absolutely tremendous. The DP had some figures which are probably a little bit old now. We had a tremendous week last week. 2,000 people on the weekend at all of the pop-ups we had across the district. Absolutely outstanding. We've got a couple of vans in our area right now. They're delivering wherever there is a community event. They're delivering the vaccinations. At our global grooves, we had 5,000 people just to celebrate our multicultural community. On the weekend, 51 people just turned up to get, they weren't booked in, they just saw the van there and got the vaccination. And very, very heartening from the young lady at the coffee shop this morning who came up to me and said, "I've got my vaccination." And she was very young, and she was in that age group that we now need to get that message across. 20 to 40-year-old age group, still a little bit of complacency about getting the vaccination. As you've already heard here today from the Deputy Chief Health Officer, the 17th of December is rapidly approaching, and I think that message is finally getting through. When Queensland and Australia opens up, we will definitely see in our community COVID. We've been pretty well free of COVID for all of this time. That's not going to continue. And the only way we can combat that is to have everybody vaccinated. And that's our task right now. And we're, from a community's perspective, from the HHS's perspective in our community, I think we're doing a great job. They did a tremendous job this last weekend, and that will continue. You can see the numbers here today. So our message, backed up by all the mayors of Queensland, is you just got to get vaccinated.
Look, we're a bit disappointed with numbers throughout some of the remote Indigenous communities throughout Cape York and the Torres Strait as well. I think we've done very well to keep COVID out of those remote and isolated areas. But as the DP said, December 17, the state's going to open up, and we're seeing the numbers in Victoria and in New South Wales. I'm just urging every Aboriginal and Torres Strait Islander people within the state, your best defence against COVID is to get vaccinated. COVID's here to stay. Let's prevent rather than react. Reacting is too late. Thank you.
The Local Government Association of Queensland represents 77 councils from Brisbane to Boulia to Bamaga and all the councils in between. And we've got all of those councils represented here in Mackay this week for part of our annual conference. And this is an important stand that mayors are taking to demonstrate to their communities that vaccination is critical. As has been said, come December 17, the Delta variant will be out in Queensland as people come across the border from New South Wales and Victoria. The safest way to protect yourself and your family is to get vaccinated. So take the opportunity, wherever you are in Queensland, to have yourself vaccinated, have your family vaccinated, and particularly think of the lives of others that you might well contribute to saving by ensuring that you're vaccinated. Get vaccinated.
Is that everyone? Any questions?
Just on that Uber driver at the Gold Coast, is it true that he's under police guard at the hospital after trying to escape and abuse staff?
Do you have any information, Peter?
Yeah, currently you'd have to talk to the police about the exact details, but he's in the ward at the moment and he hasn't left the ward. There's no risk to the public, no risk to other patients and no risk to staff, and the situation is in control.
Have authorities been able to speak to him yet?
For a number of reasons, he's been difficult to get a full story from. He has been very sick, and that's limited his ability to talk to us at this stage.
How many cooperative?
He's been relatively cooperative, yes.
How many additional resources have been put in place to keep him in the COVID ward?
No additional resources from a health perspective. We manage him the same as we're managing every other person, with strict infection control processes and negative pressure rooms where needed.
Are there extra police at the ward?
There are always police involved in the management of COVID, but nothing additional. As far as extra police, you'd need to talk to the police about that.
And is there any update on the investigation into how he got into Queensland?
You'd need to ask police that question, I'm sorry.
Police have referred us constantly to Queensland Health over this issue. That's why we're asking you.
No, that's okay. Look, I can't really comment on what police are doing as far as investigations, and I would have to pass that back to them.
Are you concerned that he tried to escape from the hospital?
Look, we're concerned about every person with COVID, but I think the lesson from this is that people behave differently, and the systems in place worked, and he didn't leave the hospital, and there's no risk to anyone.
And Deputy Premier, how do you feel that about 1,300 of the more than 13,500 vaccines that were done across the weekend were at the Gold Coast schools? Was it enough considering the risk of COVID in that area that only 1,300 vaccines were done there?
Oh, the vaccination results at the weekend were fantastic right across the state. We saw the clinics, pop-up clinics in schools were particularly successful, and we were also able to confirm that we would be expanding the pop-up clinic program this weekend to include surf life-saving clubhouses as well as the major theme parks that people will be visiting for what will be a long weekend in Brisbane.
Will you be calling out any of those regions who had a low turnout over this last weekend?
So we'll continue to highlight the results region by region so that communities can know what their risks are, and community leaders like those that you see here can get the message out to their communities. So those rates are critically important, while our statewide goal is to get to 80% by the 17th of December. There will be variations. That will be an average across the state, and it's in every single region's best interests for them to achieve the highest possible vaccination rate by that time.
Do you think you can reach that target in time?
We're quite confident that we'll be able to reach that target statewide, but as I say, our concern is that some regions are lagging behind. And it was great to hear from the Mayor that the data that I had, I think that just was from just before the weekend. There's been a great weekend here in Mackay, and so I really hope that those results are better now and continue to get better, particularly over this next week or so is really crucial.
Back on that Uber driver, are you concerned that he tried to escape from hospital?
Look, I only know what's been reported publicly. Obviously, if those reports are true, that would be concerning, but our hospitals are very well equipped to deal with people, no matter what their behaviour is. You've got to remember our hospitals and our nurses and doctors and other health staff, they're experienced at dealing with people with the full range of conditions right through to serious mental health issues, and so they're used to dealing with people who might not want to be there, who might become aggressive, and so they have systems in place to deal with that.
This guy is saying that he doesn't even have COVID. What do you say to that?
Well, I think I'll take the word of the tests. The tests came back positive. They say that he's positive, and so we've always acted according to what the tests say, what the results say.
When will the government release an updated roadmap for South East Queensland for people who have been vaccinated and also restrictions to be unvaccinated?
The key roadmap right now is the one that we've been talking about, achieving those 70, 80 and 90% targets. That's our roadmap, and that's what we're working towards.
Obviously, there's a mandate for some health professionals for the COVID-19 vaccine. Will the government mandate vaccine for other government workers like teachers or department workers, that kind of thing?
We don't have plans for that right now. Our goal is to get to those rates as quickly as possible, and I know that the people who work for the government, they're community leaders in their own right, and I'm sure they will all go and get vaccinated.
The opposition is calling for a new campaign with medical experts fronting cameras to persuade the public on vaccines. What do you think of an idea like that?
Oh, look, we have significant effort going into communicating with the public. There's a lot of communications going on, including press conferences like this one, where we have all of the mayors from right across the state. There's TV campaigns. People have been hearing from the Chief Health Officer and the Deputy Chief Health Officers each and every day. They are medical experts providing that advice to the public. But frankly, the state opposition has no credibility on this. Their own health spokesperson is a member of an organisation that is anti-vax and that has questioned the science around vaccines, that has supported rallies that are anti-vaccination. So frankly, the one thing David Christofouli could do to support our vaccination effort would be to pull his own health spokesperson into line.
Yesterday you mentioned Charlie Cameron would be visiting the regions to promote the vaccine. When is that happening and where?
So he'll be in Mount Isa tomorrow. So that's exactly the kind of thing I was talking about earlier when I said working with mayors, we can identify the best way to get people vaccinated. So the mayor in Mount Isa, she had already said to the health service that the place people go when they come to town is Kmart, and so there's a pop-up clinic outside of Kmart. And she said to me that the local legend, a Mount Isa boy, now an AFL hero, Charlie Cameron, would be the one person that young people would listen to, that particularly young First Nations people would listen to. And so we got on the phone to the Lions. They lined it up really quickly, and Charlie will be on a plane to Mount Isa tomorrow.
You mentioned earlier that vax clinics will be opening next weekend at tourist spots, say like theme parks in South East Queensland. Has the state government considered maybe a tourist spot in the Sundays like an island or something like that?
Our health services are constantly reviewing what locations are suitable, both in terms of where people will be and also whether they've got the the physical space and resources that are required. And so I'm sure if there are opportunities to do that, they will. I know they're working right now with resource companies, talking to them about their mining camps, their other operations, and so we're really just trying to get vaccinations to where people are. We know that the people who are most eager to get vaccinated, they've been vaccinated. Now our goal is to get to those who may be just a bit less motivated, and so we need to be where they are.
Deputy Premier Shannon here, can I ask a question?
Yeah, I'll come to you in a sec, Shannon. There's one more here.
Can businesses expect the government to ease restrictions for those who are that only permit vaccinated people to attend?
We've indicated that we will consider that, yes. So in the roadmap, we've said that at the 80% mark, businesses could choose to be vaccinated only, and if they did so, they would be exempted from those other public health restrictions like social distancing. So that's embedded in the roadmap. We've been talking to businesses and industry about if they want to avail themselves of that. It's optional. It's framed as being optional, but it's there particularly for those businesses for whom those social distancing restrictions can be quite onerous. Now, I'll just go to Shannon on the phone. Yes, mate?
G'day, Deputy Premier. Sorry, I just wanted to ask you about the Olympics. What tangible things will the government do to go climate positive, or as it's called, carbon negative, for the 2032 Olympics?
So a crucial part of our bid to the International Olympics Committee was that this would be the most sustainable games, including being carbon positive. We're already in a great position to be able to do that because of the amount of renewable energy that we produce, but by 2030 we'll be producing half of our energy through renewable energy sources. That's our renewable energy goal, and we will continue to go beyond that. So by 2032 we'd expect to be beyond that. We will also ensure that it has the lowest waste profile possible. The new venues that we build, they'll be much more energy efficient, making the use of best technology. So while the entire plan, will come together over the years between now and then, I'm very confident that we can meet the commitments that we made to the global community that this would be a very sustainable Games.
You're here today.
Obviously, you have to go carbon negative, or what they call climate positive, so you have to go beyond being carbon neutral. Do you also plan to do something like, plan an Olympic state forest, or, make all Olympic chauffeur vehicles electric and hydrogen, anything like that?
Yeah, I expect that we'll be making use of the full range of technology. So by then, not just hybrid and electric cars, but also hydrogen vehicles. And what we did for the Commonwealth Games was we planted a lot of trees around the Gold Coast. I don't exactly recall the number now, but no doubt there will be other environmental programs like that that can both improve, improve the livability and sustainability of the region, while also delivering carbon offsets for those emissions that can't be eliminated.
Just finally, last question. This will be the first Games that has to be climate positive. I know others before us are trying to do this, but this has to, by the agreement that we signed, be climate positive. How much will it cost taxpayers to go this way?
Look, everything that was in our bid was included in the budget, and so all of the anticipated costs will be in there. But I think this Olympics is going to be an incredible opportunity for our state. It'll put Brisbane and the region and our state on the map globally, and will come with very significant economic benefits, including for being able to tell the world that this is a carbon positive Games. And there's one more from...
One last extra question from me. Sorry, Sport Minister Richard Colbeck suggested earlier this week that the budget will probably be a bit more than the estimated $5 billion already. Will we have the money to pay for that?
Of course we will. As I understand it, the budget was set in 2020 dollars, and so obviously costs will increase between now and then. That'll be incorporated into the budget.
You're here You're here today as part of the LGAQ conference. They've got...
He just hung up. It's like he's not interested.
There's 108 different motions that members of the LGAQ will be voting on Wednesday. They range from things like reviews of the Office of the Independent Assessor and how those complaints processes are handled. That's obviously in light of what happened last week with the Barcaldine mayor. I guess... whichever motions they decide to vote on, will you be reviewing them and adopting some of them?
Yeah, we do every year. So every time the LGAQ conference happens, they pass motions. They then send to each minister the motions that are relevant to their portfolios. I'll certainly be meeting with the leadership of the LGAQ to talk about those that are relevant to my portfolio, and those that we support will then will then get incorporated into what we do as a government. It's a very good process. Thanks, everyone.